Thank you, Professor Brano. Thank you to our distinguished panelists for an insightful and engaging discussion. Fantastic, fantastic platform. Thank you, everybody. So we will now move to the final segment of our program. So it's my pleasure to invite Dr. Ganana Warku from Dubai University and one of the senior P2P members in Dubai, and Dr. Egbe to provide a brief summary of the key takeaways. Dr. Ganana is an associate professor of economics at the Dubai Business School, University of Dubai. He earned his PhD in economics from Johannes Kepler University, Linz, and MSc in Economics Policy Analysis from Addis Ababa University, and a BSc in Mathematics from Addis Ababa University. He began his academic journey at Bahar Teachers College, now Bahar University. His work sits at the intersection of economics and advanced analytics with a focus on microeconomic analysis, econometric modeling, and the application of artificial intelligence, economic prediction, and analytics. Of course, everybody knows Dr. Egbe. She doesn't need much introduction, but she's my partner in this journey. Is Oxford educated, co-founder of Anandaj, and bring extensive experience at the global stage. Our partnership between P2P and Anandaj began during the COVID era with a shared mission to educate and engage the African public and institution and advance policymakers. Please join me in welcoming both Dr. Ganana and Dr. Egbe.
Yeah, okay, very good. Okay, I've been trying to use again AI to summarize the ideas mentioned today. Probably if Dr. Nauga, if you allow me to share, I can show you whatever I have in front of me, but I can also proceed without it if you want.
Sure.
I cannot share, yeah. So one of the takeaways from the discussion and from the panelists is one of the things is like AI is no longer an option. I think the first speaker, the first panelist also mentioned that because there is a gap between the health physicians versus the demand for health care. So that gap naturally is very high in Africa. So AI will play a lot in that sense. So AI is not a luxury for Africa. That's one of the points mentioned again and again. You see it, Dr. Nauga? Do you see this?
Yes, yes.
Okay, great. Okay. So I just generated it through using AI. So some of them are a lot. So this is the first point. But therefore, the practical application of AI have been mentioned here and there in Ethiopia for malaria detection, Nigeria, policy change. I mean, Rwanda also, these are mentioned here and there. So the idea is this AI is not new to Africa here. The only thing is that we lack some aspects of the infrastructure here. So the key constraints include, like, for instance, electricity have been mentioned by a couple of the panelists. Weak internet connectivities are there, lack of high quality local data. These have been mentioned here. And then weak governance infrastructure is also mentioned that. So data also have been a problem. The first speaker talked about that. So these are all the different types of problems mentioned here. So this should be somehow managed. So the strategy direction can focus on the following. For instance, developing a strong and localized data infrastructure system. This is very important here because the whole idea is like whatever you use AI is whatever input you have provided to the AI here. So I mean, a very interesting example was mentioned by one of the speaker saying that here is about, I think it's like from the Bahar University, is the face recognition problem here. So therefore, we need to have local data on that. That should be strengthened here. Then capacity is also another issue. So many things are mentioned that I can share here. So let me go to the ethical and regulatory considerations here. I think in terms of that, a number of them have been mentioned. That ethical consideration of AI, that can be in terms of it should be there in government structures. It should be there even in the use of AI in the school. The presenter from Nigeria have been mentioning that. So ethical considerations should be there. So I can say, therefore, at the conclusion that AI represent an opportunity in healthcare system. It improves efficiency, access, outcome. So implement responsibility and strategically. AI will not only enhance health delivery, but also significantly improve life of Africans here. So this is what the important takeaways from these discussions. Thank you, Dr. Nabka.
Thank you, Dr. Ganana. Nicely epitomized with powerful pointers. And Dr. Egbe, my partner in crime.
Thank you. And so I'm not going to repeat what Professor Ghana said, and he was obviously much more eloquent and used AI. He used AI for the summary. So it also shows or demonstrates the importance of AI or to integrate stuff together. For me, the biggest takeaway is that encouraging AI across the African health space is complex. It involves sort of multi-stakeholder issues, and although we emphasize what the medical schools should do and what the deans should do, it's important to think about two things. In China now, from the age of 6, they're exposing the children to AI literacy. So we also have to think about what happens, with people as they're coming into medical school or whatever, healthcare or community health workers. Really, it's something that should affect the whole educational sector. And I think the other part of the end, which I mean, Professor Manga said, was really important to think about post-service. Once they're trained, how do you keep them up to date on these issues? And I think that's what I will say. But two things, please fill the surveys. We really want to understand where people are on this AI journey so that we can better support. And the second, as the moderator said, based on the questions asked, we'll be generating more sessions for more sort of AI webinar discussions. But this has been an extremely rich conversation. But I think it just shows you that it's such a critical, complex area. Over to you. Back to you, Dr. Nago.
Thank you so much.
Yeah, probably Dr. Nauga. I think Dr. Egbe mentioned it very, very nicely. The introduction of AI from childhood. That is, she mentioned it very, very well here. The other thing also you mentioned, but I really saw my note here, is the PP model here. The private-public partnership is also something which was not addressed in both of us.
Okay. No, you're right. And I think it was also addressed because in many environments and many African countries, the private sector tends to lead. And how do you bring that and it even happened in the US, but how do you bring that to the public sector? Completely right. I agree with you.
Thank you so much. I think it is exactly for this reason. Even today's conference has been organized by a university, Bahada University, Anandach, and people to people, and co-hosted by African Renaissance TV Services, which has over, at least in Ethiopia, 30-40 million people watched, and also the Arif Bey, the fintech institutions in Ethiopia, which means that this information, this discussion is going to be shared by millions. So it really takes more institution, more organization to come together to turn our dreams into reality. So as we conclude, let me emphasize that this is not a one-time conversation. Our intention is to continue hosting these webinars every 3 months, building momentum, sharing knowledge, and moving steadily toward establishing a center of excellence in AI at Bahardar University. Our goal is to spread our wings to other universities, strengthen partnership, and create a collaborative ecosystem that drive real impact. And let us remember, AI is like a connective tissue. It brings together institutions, ideas, and innovations, enabling us to work as one toward a common purpose. I would like to extend my sincere gratitude to our organizers, our distinguished panelists, our moderators, and all our speakers for their invaluable contributors. Above all, I would like to recognize our dedicated volunteers. Without your commitment and hard work, this would not have been possible. I would also want to recognize the Artists Africa Renaissance TV CEO. He's attending this, and thank you all. And
Dr. Naugao, before you close,
yes,
just if you can give me 1 minute.
sure.
There is one comment in the chat that really struck me, and I strongly suggest that should be the topic for next discussion. So I think this was from Adam Rubin. He said, also, we need to discuss the pathways for AI. Currently, data has to flow in and out of country borders because AI is hosted in the cloud abroad. It needs to be hosted locally in many cases due to local laws. Need to discuss this. I really think that data center topics, I think that's is what's missing because I think it was mentioned by Dr. Gabel and also by Dr. Egbe that there is only 1% of data is from Africa. So data center similar, these are topics I strongly suggest should be a topic of discussion for next meeting.
Fantastic. So maybe Mr. or Dr. Adam, if you don't mind, if you reach one of us, we'll be more than happy to brainstorm and bring your ideas and to the stage. And hopefully, you could, it's easy. You could email me, imhari@yahoo.com. Just easy one. And hopefully, the good thing about this data system is Bahardar University is also one of the universities that have been assigned to develop this data system. And hopefully in the future, when Bahardar is also geostrategically well situated, when GERD is in full work, this is going to be as data requires a massive amount of energy, as somebody was saying, electricity and others. So the future looks good in terms of developing and pushing AI. At least Africa has always been behind. Maybe this time we should not miss this opportunity. I think it's a good start, and the challenge is huge, but together we can turn our dreams into reality. And thank you, everybody. Stay tuned and have a rest of good day.